as Jefferson said, I'm Marco. I'm responsible for the innovation program in HC. HC is the Hospital das Clínicas of the University of São Paulo Medical School. So we have a short presentation here with InnovaHC in HC, and after that we will introduce the OpenCare 5G, and Marcio will help me to in this part. So HC is the largest hospital in Latin America. We have four pillars here, and the first one is the clinical care, when with the assistance of the population of São Paulo State in Brazil. We connected to the government of the state of São Paulo, and education and research when we connected to the University of São Paulo Medical School. And the last one that we create is the innovation area that we call InnovaHC. And HC has 9 hospitals here, the specialized institutes such as heart disease, radiology, psychiatry, kids disease, and all this is connected to the research laboratories that we have more than 61. And inside these laboratories, we have more than 200 research lines in medical area. So what I say is is a complex that work with healthcare in Brazil and promote quality and sustainability for the system here. And InnovaHC is our innovation program, our technology transfer office here. And inside the InnovaHC, our program is to enable innovative solutions and business that meet the Brazilian healthcare system and the problems that we have. Our goals is to promote access and quality healthcare for the system and sustainability to the system, because we have a universal system that offer healthcare for all the population. So we are a development country and a huge country that will have huge problems too. So we are try to promote the entrepreneurship and innovative culture to meet these problems and solve some of them using technology and creative solutions to engage of people and government here in Brazil. So we have 3 pillars that we act here. The first one is the innovation culture, that when we structure actions in order to promote entrepreneurship and innovative culture inside the hospital to our researchers, doctors, and employees. And the idea of this program is to connect these people with training, events, and programs that you can develop the innovation in healthcare here in InnovaHC and the Brazil as well. The second pillar, when we have the technological co-development, this idea is to support the Hospital das Clínicas and the healthcare system to using the collaborative constructions and projects, to using this innovative solutions to solve the healthcare problems in Brazil. That's the idea. And inside of these verticals, when we the OpenCare 5G is working, because we provide a real environment and validate and good validation from this project to before to enter in the system. And the last one is the connection to the ecosystem. When we try to foster this ecosystem, the innovation ecosystem in Brazil. If you, the next please. And this picture is the map. When we try to connect to government, academia, companies in general, all the players that work with innovation in healthcare in Brazil and around the world. And the InnovaHC, the idea is the InnovaHC to connect all these players to improve the quality of the projects and to improve the quality of the healthcare system in Brazil. In addition, we have laboratories that we try to foster some areas of the innovation in Brazil, that the areas that you have more problems or more opportunities. And here we have 4 of them. The first one is the digital health, when we connect all these innovative ideas in digital health inside the Nova HC in Brazil and try to organize them and put a framework for these ideas impact the patient journey and the journey of the healthcare. The second one is the laboratory, that when we have all the process of the artificial intelligence. Our idea with this laboratory the idea to create this laboratory start when we have most of projects is using artificial intelligence and machine learning, but we don't have all the structures to help them to develop. So the ideas inside the laboratory, we have good data sets, we have structures to validate and homologate the algorithm, and how the doctors will put them inside the medical practical. So this laboratory is the main laboratories, the innovation laboratories inside the Nova HC. And the last one, when you use in the robotic surgery labs, when you use laparoscopic and robotic surgeries to improve this area, the training and using this inside the healthcare system in Brazil, and try to connect them to innovation. And we work with hardware, software, and biotech, and we have partnership with the public and private sectors inside and outside of Brazil, and Deloitte is one of the main partners that we have. So we try to connect all this partner with the ecosystem. And I get some examples here that we do. For example, is one of the platform that we can integrate all the bone marrow journey with a technology. For example, the idea is we can connect the patient with the home monitoring and nutrition and doctors and all the needs that these patients have. So we can manage them during the journey. And the idea is in the end is to discharge this patient from the hospital as fast as we can. In this project, for example, we have 7 days that the patients stay inside the hospital. In the end of the process, our idea is that the patients could go to home in 3 days. That's the idea of this page. And here some examples. For example, what the accurate mammo is from the mammography, that the patient entering the machine, and the first acquisition of image, the artificial intelligence algorithm check with this position is the first image is okay, and this a green light to the start the exam, because we have some recalls because of the positioning of the women inside of the equipment. The two of them is the other ideas using drugs to snoring, and one of them is to use the technology to improve how the patient will get the power again with the members. Né? And the 5G, the OpenCare 5G is one of the more main projects here, and we try to use the technology, the connectivity, to enable some of the service that we can do with the population in Brazil, most of them in the remote areas when you don't have all the facilities and all the service that you have here, for example, in São Paulo. And we have one video that is the video that explains how this project starts, because we go to this area, for example, the Amazon River area, and it starts to promote the teleconsultation using telemedicine. So the success of this project needs more steps, and one of them is why I don't offer point of care system to diagnose this population in this area, because when you need to transfer them far from the big centers in Brazil, and is the sustainability for the system become not good. So this video explain for.
Eu vejo que a saúde no Brasil tem 3 grandes problemas, né? O primeiro é o acesso, o segundo aspecto é desigualdade e o terceiro é custo. E a saúde digital, ela responde para esses 3 problemas.
A medicina à distância já é um fato, né? Eu acho que a gente pôde experimentar uma evolução um pouco mais rápida nesses últimos 2 anos, nos processos desses atendimentos digitais, atendimentos à distância.
Nós bebemos mais da lavoura e da pesca, né? E aí a gente vai trabalhar na roça. Eu sou uma lavradora, meu marido é um pescador. Paysandu está localizado no Médio Lago, são 74 comunidades e o acesso de Santarém pode ser feito de balsa. São 3 a 4 horas de balsa. Os carros são desembarcados lá na comunidade de Aninduba e nós temos mais aproximadamente 2 horas de carro, quando a estrada está boa, porque quando o acesso está difícil, demora mais. A UBS do Paysandu, ela não tem médico cadastrada na equipe. Nós éramos uma equipe com enfermeiros, técnicos e os demais profissionais.
No momento que a gente estava passando tão mal, a gente ficava por aqui mesmo. Se a gente tivesse condições, a gente ia para Santarém, senão ficava aqui, se cuidava aqui mesmo. Era difícil, era muito difícil mesmo.
Mano, era uma dificuldade perigosa. Muito, muito, muito. Às vezes morrer as pessoas que a gente não sabia nem de quê, porque não tinha médico, né? Era muito difícil para a gente andar daqui para Santarém, né?
A gente tinha que praticamente escolher quem ia para o médico, porque são muitas pessoas que precisam do médico.
Ela é a doutora Flávia, tá, Josma? Ela é nossa médica na BS Digital, tá vindo todos os dias. Pode conversar com ela. E que eu vou comer. Essa aqui é só tirar.
Para mim foi um atendimento muito bom mesmo.
Nós temos a nossa médica todo dia, graças a Deus. Ela atende muito bem. Eu estou fazendo meu tratamento com ela. A hora que nós quiser vir, na semana, no mês, a gente vem e fala com a médica.
Então a gente é capaz de prover o melhor cuidado para aquela população com o uso mais racional dos recursos.
95% das demandas da comunidade foram atendidas através da telemedicina, sem a necessidade de encaminhamento para atenção especializada ou para um atendimento médico presencial, o que demonstra resultados muito satisfatórios, principalmente para a gente continuar com a expansão desse projeto.
A PS Digital, para nós, foi um sonho. Isso para nós é uma felicidade muito grande. Santarém, assim como todos os outros municípios no Brasil,
tem muita dificuldade para conseguir médico, pela questão de localização, acesso, pelas dificuldades que são encontradas para quem vem para trabalhar no interior. E a APS Digital, eu tenho certeza que está vindo para melhorar. Pela experiência que nós já tivemos, os pacientes que foram atendidos, pela satisfação da nossa população, nós entendemos que talvez essa seja a solução para onde não tem médico.
So thank you so much, Marco, for participating in this conference. And as you can see in the video, the telehealth was provided by interaction between the local nurse and the remote doctor. But the system required more improvements. For example, if we could connect some devices, medical devices like portable ultrasound, we could improve the services to these remote communities population. So when Deloitte approached this project, and we tried to solve this problem, how we can improve the healthcare assistance for these remote communities by leveraging technology, especially advanced communications. So the idea was to connect this portable ultrasound to this remote, and put the portable ultrasound in the remote communities that could be managed by non-doctors, and this portable ultrasound connected through 5G to a remote center. And what happens is that in those regions, usually it's very difficult to have a connectivity because it's not commercially profitable to have a connectivity. So we need to figure out a different type of communication architecture, because we're not able to attract the local carriers, the current carriers or current operators. What we have done is we create a new network called private network, Open RAN private network, which is 100% virtualized and which does not rely upon the traditional operators. This is one type of solution. The second is the telediagnostic using the portable ultrasound. And also the transformation that we have promoted is the transformation of workforce, because we are empowering the local people in order to conduct primary healthcare services. Please, next slide. So to do this, Deloitte has led this project called the Open Care 5G, and we aggregated our partners, technology partners, as well as local enterprise like Banco Itaú, and also a Brazilian government like ABDI, in order to build this network, in order to build and to enhance this telehealth service. And please, next slide. So this is the idea of the project, that we could have on the left the portable ultrasound that could be managed by non-doctors, and the images of the portable ultrasound and the connections between the conversation between the non-doctors and the doctors could be done, could be conducted through 5G in a virtualized 5G. Next slide, please. And as I told you before, the idea was to, since we do not have the operators, the traditional operators, we had to build this network from scratch using a virtualized mode. And this network function is run in the traditional servers. So this architecture is called the Open RAN, 5G Open RAN. And we have a special spectrum license from the Brazilian government that we used to connect all these devices to provide this type of solution. Please, next slide. So, and the idea of the project is to expand the healthcare assistance in terms of geographically and functionally, and also to promote more and more education and research by using how 5G and AI and other technologies can leverage the healthcare system in Brazil, and also promote the local innovation ecosystem like this laboratory became a test bed for new communication technologies. And also we are using this project as a sandbox for regulatory change with the Brazilian government. Okay, so this was the challenge that we have addressed here in Brazil. And this project became a very a landmark in Brazil. And we are trying to promote more and more this type of solution to address the issues of the public health care. So thank you so much. So thank you, Marco Bego, for participating in this event. And it has been an honor working together with you in this project and several other projects in Hospital das Clínicas. And thank you so much, Jefferson, for inviting us to this conference. I will hand over to you so that you can conduct the next use case.
Thank you, Marcia. Thank you, Marco. So this is an amazing project using new technologies like 5G and AI. So I know you are doing a really relevant work in using the telecom and also analyzing images by using AI. Thank you so much.